So good afternoon, dear colleagues, dear friends. We are here today in this warm day, at least here in Athens and in UK where Adri is, and for another webinar with the Fulkas Compass. For those who don't know me, I'm Dr. Lefteris Tabakis, and I'm the homeopathic coordinator of the Fulkas Compass. Let me tell you that this session is being recorded and will be uploaded in YouTube for you to see. In YouTube, in our channel, you can also see the old sessions we had with Andrew. Please write your questions and answers, your questions in the chat to be answered in the end. And Andrew Ward needs no introduction. He's an experienced homeopath with a busy practice based in UK. He has presented so far very interesting cases. And today he will be presenting a case of periarthritis of the shoulder, a condition that can be very stubborn, especially if we don't find the correct remedy. So, dear Andrew, the floor is yours.
Thank you very much, Lefteris. Welcome everyone to this webinar for August. Thanks very much for joining. I know it's the holiday season, so very happy that you've joined. So we'll get started, and I will share my screen. Actually, I'm going to share something else to start with. No, share. Oh, where's the share gone? Share. I'm going to share. Okay, I just thought I'd do a quick explanation of periarthritis of the shoulder, this case that I will show. Commonly known as frozen shoulder. I'm sure some of you have had this condition. Very, very common, and takes up a lot of time and resources in the health service, where there's not really an answer to this condition. It's also known as adhesive capsulitis, condition causing often severe chronic pain and stiffness in the shoulder capsule. It often develops without clear causation and progresses through 3 phases. So the initial freezing, which is the most painful phase usually, then the frozen, persistent stiffness and immobility, and then the thawing, so the gradual releasing of it. And these, we see the typical symptoms and time scale here. So the initial phase, 6 to 9 months, with worsening pain, particularly at night. So that's typical that I've seen with this. And then this reduced mobility. The frozen phase can be up to 12 months, with the pain maybe easing slightly, but the joint becomes very stiff and immobile. And the third phase can be up to 3 years, where this mobility and stiffness gradually goes. Now, the treatments, traditional, conventional treatments, are pain relief, non-steroidals like ibuprofen. Then steroid injections will often be done into the joint to reduce the inflammation. These can be quite dramatic, but they don't last. And physiotherapy, and sometimes there'll be surgery may be considered to release. some of the problem. So, okay. Let's get on to the homeopathic case. Okay. This case came to me right at the beginning of the year, and was an old patient of mine that I treated her children, so I hadn't seen her for many years. She came with this frozen shoulder of about 1 year's duration, so we're pretty much into the second phase now, where it's really immobile, but still very painful. Current treatments have been physiotherapy, steroid injections, and painkillers, none of which she said had done anything really. She's 48 years old. Unbearable pain is how she described it. And she'd been suffering for about a year with this very painful right shoulder, with loss of mobility, so she can't raise her arm above waist height or put her arm behind her, so it's very difficult to dress herself. Feels lame, she said, like a horse. The arm is almost useless. Can't find a good position to put the arm because it's so painful in any position. And as is typical, it gets much worse at night. We don't really know why that is. But this makes sleep very difficult, leading to sleeplessness, insomnia for the last year, because it's very difficult to lying on it's painful, lying on the opposite, there's no comfortable position. But actually, much worse lying on the painful side. And worse from any jarring, so sudden stepping movement of the arm, and it makes her shout. Had one steroid injection, often feels a twitching in the right arm muscles. She's become very sensitive to noises, which can lead to headaches. And then it seems that she gets more pain in the shoulder and deltoid. It's also noted that last July, so the previous year, she started having hot flushes with periods. The periods hadn't stopped, but started getting hot flushes and was put on to hormone replacement therapy. But this condition had started previous to that. A general history of sunstroke 25 years ago, and has an allergy to mussels, the shellfish mussels. Hot feet, uncovers them at night because they get hot and burning. So this was pretty much the case. Very, very much the pathology very much on the physical level, although with a knock-on effect to her state of mind, because 1 year of pain and she's getting very desperate and low with this condition and hasn't been able to sleep. So this is having an mental emotional effect on her. But otherwise, the focus of this problem is on the physical level. So repertorization. So we do have a mental symptom here that is more peculiar. The other symptoms are feeling low because of the pain, and this would not be so odd. I think most of us would feel rather despairing if we had pain for a year. In fact, I've had this condition in the past, probably 20 years ago or more, 25 years ago. I had a similar thing in the right shoulder, and the pain was really the worst pain I've ever experienced, because the nerves that come through the right shoulder joint, there's a whole group of nerves that come through into the upper arm. And if they get trapped or impinged on, the pain's unbearable and you can't get to it, you can't change it. And it was the only time that I succumbed to taking painkillers in about the last 40 years, because it was unbearable. And I got the strongest possible painkillers because I couldn't find a remedy. Painkillers didn't work. And then I remember contacting Professor Vitaukas and asking him. He suggested a remedy that I took. It didn't act. So I then went on to take something else, which acted almost immediately. And I'll explain later on what remedy that was. But the relief was unbelievable, because the remedy acted within half an hour. And after lots of repetition, the pain went away within about 48 hours. And the relief was unbelievable. Relief from this kind of, and the pain was 24 hours. There was no getting away from it. So kind of, what do they call this? Brachial flexure, the nerves that come through the arm. It's very painful. And then you can't move the arm. So it's similar to this. So repertorization, we have this sensitivity to noise that's come stronger as a mental symptom. This is quite important in this case. Obviously, the nerves are affected and there's less sleep. So this sensitivity's come. We've got the hot feet. We see here, hot burning feet uncovers them. She feels that her extremity, the right upper limbs are lame. So we've got lameness. It's a good rubric, meaning they become almost useless. This condition was specifically the right shoulder, and worse turning in bed, worse lying on the painful side, worse movement of the arm, worse putting the arm behind and raising the arm. So raising the arm and lying on the painful side, we've put in higher degree. Some hot flushes are very prevalent, and the jarring, so the pain from stepping. So you see here, it's virtually all physical symptoms, very one-sided in a way, all in one department. So when we look at this analysis, we get the results. We see an interesting remedy that comes up, sanguinaria canadensis. And then we have ferrum metallicum, sanicula aqua, theridium azarum, etc. We can have a look at large remedies, which looks at only the main polycrests. We can look at small ones, which then takes those remedies out and brings up less well-proven remedies. So we see again, here's another muriaticum, which has a lot of problems with the right shoulder, as well as ferrum metallicum. Theridium because of the noise, and sanicula has actually quite a lot of symptoms. It's a very interesting remedy, sanicula. I have a case I could do in another webinar where I used this remedy. It's a spring water, and a very, very interesting case from many years ago. notable, you see Rustox and Ferromuriaticum. Anyway, so sanguinaria. You can see it says 9 out of the 11 symptoms, so very close match on this case. It has the right, specifically the right side, worse lying on the right, worse at night, turning in bed, right side raising the arm, flashes of heat, sensitivity to noise is strong, hot feet, and moving the shoulder. So this, and then we have ferrometallicum with 7 symptoms. Was putting the arm behind them and raising the arm, but it doesn't have the hot feet, not specifically right-sided or worse turning in bed or lying on the painful side. So it doesn't have some of the main keynotes. Okay. So prescription on 21st of February was sanguinaria 200C, 2 or 3 doses in the day. Sometimes these sort of physical pathology, they need a bit of repetition. So I said, take it 2 or 3 times in the day, every 2 or 3 hours. Now she came back to me and said, initial dose, she felt a 5% improvement in the pain almost immediately. Took another dose an hour later, felt hot twinges up the arm and on the shoulder. So 2 doses. So then she stopped. Next day, 40% improvement. I thought this is very encouraging, quite impressive after 1 year. Since last night, same level of intensity and mobility as when it first started April last year. So it seems to have taken it back to the beginning, because of course it's increased in pain and immobility. And now it's interesting, it's gone back to the beginning after 1 day. And then she told me after a couple of days, the improvements have plateaued, stayed the same. She says, I can rotate my arm now and put it behind me better, so there's more movement, better and less painful night's sleep last night. Still a constant ache and restricted in movement, but nothing as unbearable as before. It feels like magic. I often say that. After repeat, the symptoms relapsed, so she repeated it again once it stopped improving, and it relapsed again. And she said it's almost back to square one. Not quite. So we repeated the remedy again, and she regained the improvements from before, so it got 40% better again. But now it stayed at this level again, 40% better. So what do we do in this situation? Generally, if we've repeated a remedy 2 or 3 times and the symptoms remain the same, but less, we increase the potency. So on the 27th of February, I went up to sanguinaria 1M, single dose. No further improvements after the 1M, she said. Currently, I can lift my arm nearly 180 degrees, aching pain is less and sleep improves, still can't lie on that side. But I repeat 1M a few times a day. After 3 days, no change. So it's got stuck again at this level. So what to do now? This is the question. Often you get a case like this, you get a good improvement, you repeat it, some relapse, you repeat it, improvement, but it stays, then you go higher, no change. So here I made an error because I went to chelidonium. which was a remedy that it's the remedy that helped me with my right shoulder. The remedy George had prescribed for was sanguinaria, which didn't work for my shoulder, but chelidonium did. And actually, it comes up in the, if we look at the analysis, we see that it will be here. Right shoulder pain, raising the arm, jarring, sensitive to noise, flushes of heat, motion of the arm. So it has a lot of problems, but on the right side, we know chelidonium, like podium, and particularly right shoulder and deltoid. So I tried chelidonium. 200C. And she reported no change. So we're in March now. Of March, I gave the chelidonium. So the repertorization, she still has the sensitivity to noise. She mentioned also a new symptom of she can get dizzy if she gets up too quickly. Still, the symptoms are the same. I've put in here ailments from loss of sleep. So I've added a couple of things in, mainly the dizziness. Let me see. Still sanguinaire, but with ferrum metallicum. Also, you see this symptom, lameness of the upper limbs, right? And you see here, ferrum and sanguinaire in third degree. This is how she described it in the first place. So, and the dizziness and sensitivity to noise is a big feature of ferrum. We see here in third degree, sanguinaire is there also. Pain, putting the arm behind them, motion, raising the arm, flashes of heat, we know ferrum. So I went to ferrum metallicum 30C. I thought I would start and repeat it a bit. 5 doses, and she reported no change, no improvement. So I went back to the drawing board, as we say, to reassess the case. Symptoms the same. No change. And as we see, sanguinaire is way out on top, 10 out of 13 symptoms. So I thought, okay, actually, what we saw was a 40% improvement almost in the first 48 hours of this case. This indicates the remedy was correct. So this became I was thinking about this. This became an issue of potency. Sometimes we've got the correct remedy, but not the correct potency. So I thought this kind of condition, it's been 1 year, it's a very physical pathology. This joint is seized up, it's stuck. Going higher, it hasn't led to any improvements. So my thoughts were, let's go down to, or down, it's not down, it's a different scale, to LM potencies. So I decided to put her on sanguinaria 6 daily, once a day. You're going to ask why LM6? I can't answer that. I just thought that would be a good place to start. And Okay, the follow-up 2 months later. Because I didn't hear anything. I thought, oh, well, she's given up. 2 months later, I've been taking 1 drop of the remedy in water every evening. It's been about it's actually 8 weeks, 7 weeks now. And there has been significant improvement in my mobility and in the pain. It's not 100% back to normal yet, though. Maybe 50, 60% better. The doctors now are offering me a cortisone injection. I said, no, wait. I advise you to wait. Another 6 weeks later, I hear from her. She says it seems pretty much cured now. Just the very occasional ache in the shoulder. And I've been away for a few nights and forgotten to take the remedy, didn't bring it with me. I haven't noticed any problem since stopping it. Shall I stop now? Yes. I have been taking it religiously since the end of March. So March, April, May, June, 4 months she's been taking it, which is what we know about the LMs. The idea is to take them until things improve. No aggravation, as Hahnemann told us. It's a brilliant, this is what she wrote in her email. It's a brilliant result and I'm so grateful. Thanks for your wizardry. So I'm a wizard now. And I tell everyone who can bear to listen about what a genius you are. That's interesting, isn't it? Bear to listen. Often people just can't bear to hear these stories because they don't believe them. Okay. So, an interesting case I thought to present because of the potency issue. The remedy was correct. The centesimal potencies did only so much, even with repetition and increasing. And when going to LMs, 4 months of LMs daily, the condition gets cured. So interesting, I think. These are the sort of cases that I find LMs useful for, where something needs repetition. Sometimes these kind of joint things and often skin problems, where it needs some more constant but gentle pushing of the case. So I thought I'd do a bit of a differential in the right frozen shoulder. So sanguinaria, as we've seen, is almost specifically, although Kent says it can treat left-sided, it's mainly right-sided. It's worse turning in bed at night, worse lying on the painful side, worse raising the arm in 3rd degree, whereas ferrum is in 2nd degree. It has hormonal symptoms. We know it for migraines, we know it for vertigo during the menopause, flushes of heat to the face, headaches every 7 days, better for vomiting, eructation or flatus, and hot feet like sulfur or pulsatilla. So we have an interesting remedy in sanguinaria, very useful in the menopause, very useful with migraines, where you have, let's have a look at sanguinaria. You can do it this way. Just to show you, we'll go to the results and then we'll go to Materia Medica. We see some strange things. I've only ever seen this once, this delusions. People are, it's either moving or talking rapidly around them. It's a bit of a delusional state, I think, in high fever. Lassitude, delusion, she was in some vehicle which was jarring. That's interesting, with this symptom being worse for jarring. Desires to be held, oversensitive to noise. And we keep this one in mind for this. It's one of the remedies. We see right-sided, shoulder deltoid, Vomiting always ameliorates all their conditions, particularly their migraines. Headaches come from right occipital over to the eye every 7 days. And here we have the periarthritis for the shoulder joint. Worse right arm, can't raise the arm. Worse at night, which is typical for this condition. All complaints worse by wet weather. Sensitive to odors, hot feet uncovers them. Desire for highly seasoned, spicy foods. So some similarities with sulfur, on which it's complementary. So we go back to here. Okay, ferrum metallicum, differential. Ferrum is worse on the left side, more the left, and it's worse in the daytime, not at night, the shoulder. So that's a good distinction. Better for heat. They also do have the flushes of heat and red face. Worse putting the arm behind them. That's not actually a sanguinarious symptom. They both have worse, they can't raise the arm, but ferrum, they can't put it anywhere beyond the lateral there. Better for slow motion, like pulsatilla. Tearing pain in the shoulder, can't raise the arm. Lameness of upper limbs, like sanguinarius. So there's a lot of similarities, but more left-sided and more in the daytime. Sanguinary more right, worse at night, and worse lying on it. Chelidonium, right-sided, right shoulder pain, worse raising the arm, worse abducting the arm, worse becoming cold. Pain goes into the deltoid, upper arm. Paralytic pain, worse for deep respiration, inspiration. Breathing deeply creates more pain. So these are probably the three of the main ones you'll need to differentiate. Potency. So I said here we see in this case 200C working up to 40%, then a relapse, then again 40% better. No further improvement with repeated doses or 1M. Change of remedy to chelidonium ferrum brought no changes. Changing back to original remedy, but in LM, given daily over 3-4 months, brings a complete cure. It's a good example of when I like to use LM potencies. Moral of the case, don't change the remedy. If you see good improvements and symptoms remain similar, change the potency. It's still, we can make these errors. I just wanted to do a little thing at the end about costs. I went on to AI and did some cost analysis. So for the National Health Service. So health service costs for this condition, total costs, £3,000 to £5,000 over 1 year, one patient, including GP consultations, physiotherapy, orthopedic outpatients, shoulder x-ray, steroid injection, reviews, and medication. 3,000 to 5,000 in a year. Remember, this can go on for 3 years. This could cost up to £15,000. Arthroscopic capsule release surgery would be up to another 5,000. Potential cost £10,000. Homeopathic cost 200, with £10 for the remedy. So here we have, and this is something I showed for years in the NHS when I worked there. And we did analyses and reviews, and we saw the savings were huge for the health service per patient. You know, you could be saving £10,000 to £15,000 a year per patient. You multiply that by whole towns, areas, counties, countries, you're talking millions of pounds of savings. But nobody was interested. And this is not a question of can it do this? Is there the will there to save money, which it seemed to me there wasn't. So there we are. Okay, I think that's it for this case. So we can have a look at the
Yes.
questions.
Thank you very much, Andrew. A very learning case. Because you said it rightly. The potency matters as well as the remedy. We often, after we give a remedy with a potency, and in this case you gave 200, then you repeated, you raised, and then of course you went to other remedies as we all would do. But then you are wise to come back with the LM potency which acted. And this is a learning case about the potency and not to leave a remedy that has acted. And the questions, of course, you have answered the questions about the potency. Thank you, Nicolina writes, thank you for the great case. What would you advise to the new homeopaths to choose the right potencies? What was the reason to choose 200 in this case? He means in the first description.
I think the potency choice for me is mainly about the clarity of the remedy. So if the remedy is very clearly indicated, and the patient is not, say, in a very low level of health, she had very little mental emotional problems. It was very physical. She was otherwise in good health, clear remedy. You can go higher in potency. That's my reasoning. But looking back at the case, because it's such a physically based and long-term condition, I think we do need to look at using slightly lower potencies, even so, and repeated. Who knows what would have happened with a 30C? Mm-hmm. Maybe a 30C would have repeated, would have got it to, cured as well. Who knows? But yeah, that's my reasoning. Clarity of the remedy picture.
Mm-hmm. And you said that you choose LM potency mostly in skin and joint problems where it needs a repetition.
Yes, that's right. I don't use LM potencies a lot, but because I've found them difficult to manage with patients, or they find them difficult, and I have seen a lot of aggravations, which Hunderman said, well, that's because the dose is too large, and I've tried, but I've not been very convinced. But there are some cases like this where it's fantastic, no aggravation, gentle, exactly as he described it.
Great. Okay, Alexandra asks, couldn't we have waited after the first dose of 200C? She was improved by 40%. Further improvement might have come if she wouldn't have repeated the dose.
Yeah, she did wait, but it's a good question, how long to wait. When something's so painful, it's very difficult to say to them, wait a long time. But I left it with her to assess when things were better or the same or worse. And she really did say that things had got to a point, but then they just stopped. There was no real further improvement even after waiting. So, yeah.
Mm-hmm. The next question, I don't know if anybody can answer this question. What was the reasoning behind the repetition of the first dose of sanguinaria that didn't work? I think she asked why it did not work, the 1M. So
Yeah,
the one why it did not work, I think that's the question.
yeah. We don't know these things. It's about resonance. I think there's a certain potency level that's suitable for each patient, and sometimes it just misses. The patients hear the remedy potencies here, and it just doesn't resonate. Whereas the right potency, you get a very beautiful effect.
Mhm, mhm.
Um, yeah.
Okay, and the other questions about Vifulca's brain. Very helpful case. Thank you, Andrew. Wondering if you have used or you are using Vifulca's brain. Do you see many advantages over Compass? Let me say that Vifulca's brain is an entirely different project, and we in the Vifulca's Compass team were not involved in Vifulca's brain, and with Andrew Ward is the ambassador of Vifulca's Compass in the UK.
Yeah. Yeah, absolutely.
Okay, so very interesting case about one more question we had about your case. I think you have answered about your case of the chelidonium and the shoulder pain that you had.
Yeah.
The question asks, what remedy did you
Oh, yeah.
take? You answered that you took the chelidonium. Huh? Do you want to say
Yeah,
something more about this?
I initially took sanguinaria from George Vitulkas. When I rang him, he said, take sanguinaria. And I was so desperate with this thing. I mean, the pain's hard to describe. Anyone who's had it, I would have done anything to get away from this pain. And it didn't work. I saw even it doesn't work. It doesn't work. And then I researched and thought maybe it's chelidonium. Maybe I had maybe some other symptom. And I started taking 200C chelidonium. I was taking it every 5 minutes, and then I noticed slowly after an hour or so, there was a slight change, and then better, better, better. And it's like, the relief is like you're reborn, from this sort of pain you can't get away from. And within 48 hours, it was gone, like something just released.
Which
Amazing.
potency?
200C.
200C every 5 minutes.
5 minutes.
Okay.
Which, something so severe you can do it until there's improvement, then you
Yes.
wait. But yeah, I God help, I never want that again. Touch wood. It's like a terrible thing.
Mhm.
Um,
Very good. Okay, very interesting about chelidonium and about sanguinaria. I had a recent case with sanguinaria that I gave it not in shoulder pain, but in a chronic cough, which the clear modality was he had this young man had this chronic cough, and after vomiting, she would be all right for 2 days, and then the cough started again. And so the amelioration from vomiting, not in the headache, but in the cough, led me to sanguinaria, which helped like a miracle, like they say.
Brilliant. Yeah, these keynotes are so important. Huh? These strange things that medicine doesn't take any notice of. People notice means nothing to them. To us, it's everything, isn't it? Better vomiting. We know the remedy.
Exactly.
Yeah. But anyway, I hope this will help people with these. Of course, can be many other remedies, but these three, the ferrum metallicum, sanguinarium, and chelidonium, I think may cover like 50% of the cases of frozen shoulder.
Great.
Maybe.
Mhm. Okay, a lot of people say thank you. Okay. If we don't have any other questions, I think we can conclude here. Anything else you want to add, Adriel?
No, I think I would just like to say that thank you for the support of Douglas Compass and all the fantastic work you've put into this program. It's brilliant, and we should all be fully behind it.
Thank you all, and thank you all for the support, and thank you all that you have joined today in this summer day. And we will get back to you with further seminars with Andrew. So take care, everybody. Thank you very much. And we will be in touch.
Yes,
Bye-bye.
thank you.
Bye bye.